Welcome to the Health Act channel. This is probably the most critical question we face: pancreatic cancer. It's known as a silent killer because it is often detected late, making symptoms incredibly important. The pancreas is an organ located in the abdomen, behind the lower part of the stomach. Pancreatic cancer begins in the tissues of the pancreas. This type of cancer is very serious because it is difficult to detect early, which makes treatment more challenging. This is because symptoms may not appear right away or may be mistaken for common everyday issues, not necessarily cancer-related. That's why it's crucial to know what signs to look out for. In today's video, we're going to discuss the 10 warning signs of pancreatic cancer that you shouldn't ignore. These signs act as clues that something might be wrong. Your body can alert you with these warning signs. The difference it could make if people come in earlier. How getting the right treatment sooner can change feeling unwell to feeling better or even living longer. Some of these signs may surprise you, while others might be things you've heard of but didn't realize could be linked to pancreatic cancer. The pancreas, an organ about the size of your hand located behind the lower part of your stomach. Pancreatic cancer starts when abnormal cells in the pancreas grow uncontrollably and form a tumor. This vital organ makes hormones to control blood sugar and enzymes to aid in digestion. The pancreas is tricky because pancreatic cancer doesn't show clear signs until the tumor has grown significantly or spread to other parts of the body. This is a major reason why it is often diagnosed in later stages rather than earlier. The most notable drawback of pancreatic cancer is the relatively nonspecific nature of the early symptoms. Sometimes, early warning signs can be subtle and easily misinterpreted, such as stomach pain, unintentional weight loss, or persistent fatigue. These symptoms can easily be mistaken for minor health issues, leading people to delay consulting a doctor. This procrastination allows the silent growth of the cancer. Being informed helps us make better decisions for our health and encourages us to seek help when something feels off. Let's get started. Symptom number 1, jaundice. Jaundice is a condition where the skin and the whites of the eyes turn yellow due to increased bilirubin in the blood. Bilirubin is a yellow pigment that the body produces when it breaks down old red blood cells. Normally, the liver processes bilirubin, mixing it with bile and then excreting it through your digestive system. However, under certain circumstances, the liver may be unable to release bilirubin, or there may be an issue at any point where bilirubin is removed. When a high amount of bilirubin accumulates in your body, you may become jaundiced. This isn't a disease on its own, but rather a sign of an underlying health issue. There are several reasons why someone might develop jaundice. This can be due to liver diseases such as hepatitis or cirrhosis, where the effective breakdown or processing of bilirubin in the liver is impaired. It may also occur when there is an obstruction of the bile ducts, which are the passages that carry bile from the liver to the intestine. This could be from gallstones, or, in severe cases, from cancers pressing upon or blocking these ducts, such as pancreatic cancer. Jaundice in adults often indicates a significant health issue that needs medical evaluation. In addition to yellowing of the skin and eyes, it can be associated with other signs such as dark urine, pale stools, and itching. These symptoms help doctors determine the cause of jaundice, as it cannot be treated without addressing the underlying problem. Awareness of jaundice and its significance is therefore crucial. It is a clear indication from the body that something is definitely wrong, particularly with the liver or bile system. Symptom number 2, unexplained weight loss. Unexplained weight loss is when a person loses weight without trying, such as through dieting or exercise. It occurs when you notice your clothes fitting looser or see lower numbers on the scale, despite no changes in your eating or exercise habits. While it might seem like a pleasant surprise to some, it can actually indicate an underlying health issue. This type of weight loss can happen suddenly and unintentionally. signaling that your body isn't getting the necessary energy from your diet. It could also mean you're burning more calories than usual due to disease processes or other reasons. Unexplained weight loss can be a symptom of various conditions, such as an overactive thyroid, hyperthyroidism, diabetes, depression, or digestive diseases. Most notably, it is also a common symptom of many types of cancers, including pancreatic cancer. Unexplained weight loss may occur in pancreatic cancer for several reasons. The pancreas may be affected in a way that its exocrine function, producing enzymes that aid in food digestion, is compromised, leading to malabsorption and subsequent weight loss. Additionally, a tumor pressing against the stomach can make a person feel full after eating only a small amount of food. Generally, cancer increases the body's metabolic rate, causing quicker calorie burning than normal. Unexplained weight loss is a warning sign that should always be taken seriously. Symptoms should be closely monitored, especially if there is a pronounced weight loss of more than 5% of body weight in 6 to 12 months, accompanied by other signs of illness. Symptom number 3, abdominal pain. Abdominal pain is one of the most common symptoms, affecting the area between the chest and the pelvis. The intensity of this pain can range from mild discomfort to severe distress. Causes of abdominal pain are varied, as this region houses many crucial internal organs, such as the stomach, liver, pancreas, and intestines, making the origin of the pain sometimes difficult to pinpoint. The pain can be characterized by its location and nature, whether sharp, dull, intermittent, or constant. One significant concern with abdominal pain is its potential link to serious conditions like pancreatic cancer. In the case of pancreatic cancer, the pain usually progresses and is typically localized in the upper abdominal region, often radiating to the back from the side. This may be due to pressure from a tumor against nearby organs or nerves around the pancreas. The discomfort can increase after eating or when lying down, and it tends to become more constant as the cancer spreads. Abdominal pain can also be indicative of less severe conditions, such as indigestion, gas, or a stomach virus. However, very severe pain that comes on suddenly, especially if accompanied by jaundice, yellowing of the skin and eyes, unexplained weight loss, or changes in bowel habits, are all reasons to seek medical attention immediately. These additional symptoms can point to a more serious underlying issue that needs to be addressed. Never ignore persistent abdominal pain, especially if it is accompanied by other concerning symptoms. Seeking timely medical advice is crucial. Symptom number 4, digestive issues. Typically, digestive issues encompass a variety of symptoms affecting the gastrointestinal tract from the mouth to the anus. These issues usually manifest as nausea, vomiting, diarrhea, or constipation, and changes in stool consistency or color, often resulting in a loose or liquid texture. Digestive problems can range from mild discomfort to severe conditions that hinder daily activities and overall health. The causes of digestive troubles can be quite common, such as dietary choices or stress, but they can also stem from more serious factors like infections, chronic conditions, or diseases of the digestive organs, such as ulcers or gastroesophageal reflux disease, GERD. In the context of the pancreas and pancreatic cancer, digestion is significantly impacted. The body's enzymes, secreted by the pancreas, aid in the digestion of fats, proteins, and carbohydrates, facilitating nutrient absorption. When pancreatic cancer disrupts this function, nutrient absorption is impaired, leading to digestive symptoms. For instance, in pancreatic cancer, nausea and vomiting may occur because a tumor blocks the stomach, preventing food from passing through easily. This can also result in changes in stool, such as steatorrhea, fatty stool, which indicates poor digestion and absorption of fats. Digestive problems associated with pancreatic cancer also include abdominal pain and bloating after eating, as the body struggles to digest food without sufficient pancreatic enzymes. Beyond discomfort, these symptoms can lead to significant nutritional deficiencies and weight loss, affecting the patient's quality of life and overall health. Symptom number 5, loss of appetite. Loss of appetite, also known as anorexia, is a medical condition characterized by a decreased desire to eat. While this can sometimes be caused by stress or illness, a persistent loss of appetite can be a warning sign of an underlying health issue. This condition not only affects eating habits, but can also lead to significant weight loss and nutritional deficiencies, weakening the body's ability to recover from illnesses. There are numerous causes for a loss of appetite, including psychological factors such as depression or anxiety, and physical conditions like gastrointestinal disorders, chronic diseases, or infections. Importantly, loss of appetite is also associated with several types of cancers, including pancreatic cancer. In the context of pancreatic cancer, loss of appetite can occur for several reasons. The substances produced by the cancer can alter the taste of food or reduce the appetite for food. Additionally, a tumor pressing against the stomach can create a sensation of fullness, even after eating a small amount of food. Some treatments, like chemotherapy, can also decrease appetite due to side effects such as nausea and changes in taste. Loss of appetite in pancreatic cancer is concerning because it can lead to cachexia, a syndrome characterized by severe weight loss and muscle wasting. Despite adequate calorie intake, this condition is more than just weight loss. It involves a host of complications that can critically affect a patient's strength, immune response, and quality of life. Symptom number 6, new onset diabetes. New onset diabetes refers to the sudden development of diabetes in an individual who previously had normal blood sugar levels. This is particularly notable when it occurs in adults over 50 years old without an obvious cause, such as significant changes in weight, diet, or lifestyle. Symptoms can include increased thirst and urination, unexplained weight loss, fatigue, and blurred vision. These symptoms occur because the body is unable to properly use and regulate glucose, sugar, in the bloodstream. In the context of pancreatic cancer, new onset diabetes can be a significant warning sign. The pancreas plays a crucial role in controlling blood sugar levels by secreting insulin, a hormone that helps absorb glucose from the blood into body cells. If a tumor affects the pancreas, it can either impede its ability to produce insulin or alter the body's use of insulin, leading to the high blood sugar levels and, consequently, diabetes mellitus. The exact relationship between new onset diabetes and pancreatic cancer is not well understood, but it is believed that the cancer may alter how the pancreas functions or how the body uses insulin. In some cases, new onset diabetes is the first sign of pancreatic cancer, especially if other symptoms are vague or absent. This makes it essential for individuals who suddenly develop diabetes without the usual risk factors, such as obesity, family history, or a sedentary lifestyle, particularly if they are over 50 years old, to seek medical evaluation to rule out underlying conditions like pancreatic cancer. Symptom number 7, itchy skin. Itchy skin, or pruritus, is a sensation that causes an urge to scratch a specific area. This can be caused by both visible and invisible rashes. Although usually mild and temporary, chronic itching can indicate underlying health problems that should not be ignored. One of the more surprising causes of itchy skin is issues with the liver or bile ducts. The liver processes waste, and the bile ducts carry bile, a digestive fluid, from the liver to the small intestine. If the liver is not functioning properly, or if there is a blockage in the bile ducts, bile salts can accumulate in the bloodstream instead of being excreted from the body. This excessive buildup can cause itching, often with little or no rash. In the context of pancreatic cancer, a tumor blocking the bile duct can stop the normal flow of bile, leading to the buildup of bile salts in the body, which in turn causes itching. This itching is often accompanied by jaundice, another classic symptom, characterized by yellowing of the skin and eyes due to the same bile duct blockage. It is a direct indication that something is wrong with the liver or bile system, which includes the pancreas. Symptom number 8, fatigue. Fatigue is one of the most common symptoms, representing an overwhelming and constant state of tiredness, weakness, or exhaustion that is not relieved by rest or sleep. This can affect anyone and is usually relieved by adequate rest. Sometimes, fatigue is a normal response to physical exertion, lack of proper sleep, or stress. However, persistent and unrelenting fatigue without any apparent cause can signal an underlying medical condition. Fatigue is more than just feeling tired. It's a health condition where a person feels drained of energy without relief even after rest, affecting daily activities and quality of life. This type of fatigue, often associated with health issues like cancer, differs from general tiredness because it isn't caused by energy expenditure and doesn't improve with rest. Pancreatic cancer can cause fatigue for several reasons. Cancerous cells outcompete normal cells for nutrients, leading to malnutrition, which contributes to fatigue. Additionally, poor appetite and digestion problems in pancreatic cancer patients reduce both the intake and absorption of essential nutrients. The emotional burden of living with cancer and the physical stress it puts on the body can also make a person feel extremely weary. Moreover, treatments for pancreatic cancer, like chemotherapy, can cause side effects, including fatigue, further exacerbating the tiredness caused by the disease itself. Symptom number 9, blood clots. A blood clot is a gel-like clump of blood that forms in your veins or arteries. It usually forms to seal off and prevent further bleeding when an injury occurs. However, clots that form without an obvious injury or don't dissolve naturally can pose serious health risks. This can lead to complications such as deep vein thrombosis, DVT, where clots block blood flow in the veins of the legs, or pulmonary embolism, where a clot travels to the lungs, posing a life-threatening risk. Some serious health conditions, including various types of cancers like pancreatic cancer, are first signaled by blood clots. Cancer increases the risk of blood clots, thrombosis, because cancer cells can produce substances that promote blood clotting. Additionally, some cancer treatments can also raise the risk of blood clots. In pancreatic cancer, the disease not only affects blood supply to the pancreas and its surroundings, but also increases the likelihood of thrombosis. When a clot moves to the lungs, it can cause sudden shortness of breath. Swelling, pain, and redness in one limb, usually a leg, are signs of a clot. The situation becomes critical if the clot travels to the lungs, leading to severe complications. Symptom number 10, changes in stool or urine color. Changes in the color of stool or urine can be significant indicators of one's health, signaling either minor issues or more serious conditions. Normally, stool is brown due to bile, a digestive fluid produced in the liver. Urine typically ranges from pale yellow to deep amber, depending on hydration levels. Remarkable deviations from these colors can provide important clues about bodily functions. Dark urine often indicates dehydration and suggests increasing water intake. However, persistent changes in the color of stool or urine can be symptoms of more serious health problems, including pancreatic cancer. For instance, pale or greasy stools can signal issues with bile production or digestion, while dark urine can indicate liver or bile duct issues. Recognizing these changes and seeking medical advice is crucial for early detection and treatment of underlying health conditions. However, when urine remains consistently dark despite adequate hydration, or if there is the presence of blood, turning urine pink or red, it could indicate liver problems or urinary tract infections, among other concerns. Similarly, changes in stool color can signal health issues. Light or clay-colored stool, or even white stool, indicates a blockage in the bile duct. This can result from various conditions, such as gallstones or tumors pressing on the bile duct. Conversely, Very dark or black stools may indicate bleeding from the upper part of the gastrointestinal tract, such as from ulcers or gastric cancers. In the context of pancreatic cancer, changes in stool or urine color are particularly significant. The pancreas plays a role in digestion and regulates enzymes that aid in breaking down food. If a tumor blocks the bile duct, bile cannot enter the intestines, leading to light-colored stools and dark urine. This blockage affects the digestion and absorption of fats, further altering the appearance of stool. Conclusion: if you recognize any of the symptoms discussed today, such as unexplained weight loss, changes in appetite, or any other signs, consider them a message to seek advice from a healthcare provider. Your body communicates through symptoms. Paying attention to these signals early can have a significant impact on your health. Do not wait and ignore these signs. Your health should never be left to chance. Regular consultations with a doctor can help you stay informed about your health issues, and frequent checkups might catch problems you are unaware of. Set reminders for monthly, quarterly, or annual visits to make them a part of your routine for a healthier life. Lastly, if you found this information helpful, please like the video and subscribe to our channel. By doing so, you are taking a step towards being health conscious and spreading awareness of such important topics. Value your health, for it is priceless. Follow your instincts and act when necessary. Let's work together for a healthier future. If you liked the video, put a like, subscribe to the channel, activate the little bell to stay updated for upcoming videos.